I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to this episode of IDD Health Matters. Today, I have someone with me who we met a long time ago, didn't we, Toni? And someone who really was very inspiring to me in some of the work that I've done. Dr. Toni Benton, University of New Mexico, family medicine professor, right? Toni, tell us about what you do in the field of healthcare for people with intellectual and developmental disabilities.
I am the medical director for a program called TES, which is in the Department of Family and Community Medicine at UNM. And that stands for Transdisciplinary Evaluation and Support Clinic. We are now in our 31st year, I believe. We are a team, interdisciplinary team that includes medical professionals, social work, nursing, neuropsychology. We've got a full team. Pharmacy, and we do evaluations statewide in New Mexico. We're funded by the Department of Health, Developmental Disabilities Supports Division. And we see patients who are having some complex presentation. It may be behavioral, new change in behavior, or worsening of some challenging behaviors that have been there for a long time, but something's changing. Some complex medical stuff, we can see people for that. We can see people for psychosocial issues or all of the above. What we do is we run a variety of different clinical programs. We do one called a TES evaluation, which is where we get in the car and we drive somewhere in New Mexico. And I had
the pleasure of doing that with you once.
So we drive out in the middle of nowhere, New Mexico, and see a patient in their home or in their in the hospital, in a
local
prison,
clinic,
or in a local
clinic. I think is where I had the.
I think we go to the community agency, wherever that team chooses for us to come. And we, before going out there, we have done a full chart review. We've gotten all the medical records, all the team records, IDT team records, therapy records, labs, x-rays, everything we can get our hands on. We've done the full chart review and put it together into a kind of a triage for ourselves. And we go see the person. We spend about a half hour with that person in their home or in their agency, wherever, or outside, where they're comfortable. And then we meet with the team and the family and the person if they want to stay and talk about what's going on for a couple of hours. And then we put together a report. We put our heads together. Well, what could this be? Is this trauma? Is this a psychiatric medication reaction? Is this new medical and they're having pain? Sometimes we put our heads together with our social work team to try to get some services. So if somebody doesn't have a team and they're living at home and they don't have any kind of therapy. So that is the TES eval. The Adult Special Needs Clinic is our second longest running type of clinic, which we do twice a month at the campus at UNM. And that is a bigger team, but it's the same basic premise. It's complex presentation. The team has already tried pretty much everything. The primary care physician and the primary psychiatrist, primary neurologist have, done a fair amount by the time they see us and still don't have an answer about why is this person having new behavior, or why are they declining physically, what's going on with this person. And we have on that team, we have family medicine, psychiatry, neurology, neuropsychology, social work, RN case management, dental hygiene, and I said pharmacy already?
I don't know, but you can say it again.
Yeah, there you go. And then we bring students to that too. We always have medical students or PA students or shadow students or nursing students with us.
So it serves as kind of a clinical support team for community-based clinicians. Is that where your referrals come from a lot of times?
They actually come a lot from teams. They can come from families. They can come from physicians.
Okay.
The only one we require a physician referral for is our adult cerebral palsy clinic, which has been in place since 2005 or 2006, I believe. That's a collaborative clinic with the continuum of care, which is in the Department of Pediatrics. But we see adults, and that is neurology, family medicine, orthopedics comes twice a year, and social work and RN case management.
It's a really what I would consider innovative model and proactive, but you've been doing it for a long time.
Right.
But still, it's a unique way of doing things, which is why I tried to copy some of it with what we did in Mississippi, because I thought it was great. And we developed something kind of similar in terms of providing consultations and education and training, and it was really based on what you guys do and the great work that you do. And I bet you probably have found some very interesting things over the years that maybe you could share a story or two of an interesting case on how that evaluation really helped improve a person's health or change their lives in a positive way.
Okay. I'll tell you about one other clinic that we do.
Oh, yeah, sorry. Yes, please do.
With the Department of Health, we have a clinic called SAFE, which is Supports and Assessments for Eating, for Feeding and Eating, SAFE. And that is family medicine, SLP, PT, OT, psychology, and an RN, and a registered dietitian. There was a case that we saw as kind of an emergent case a few years back. A gentleman with spastic quadriplegic CP who got a new wheelchair and did not have any services. So he didn't have any physical occupational therapy. He wasn't on any DD waiver, any kind of supports through the Medicaid waiver system. And his mom had taken him to Texas to get his wheelchair fitted. A DME did it. A DME provider did it. And he was fit into a wheelchair. But that's the key word. He was fit into a wheelchair.
Gotcha.
He had profound kyphoscoliosis, bilateral dislocated hips, and fixed pelvic deformity. And they put him in all straight 90-degree angles, strapped him in, Velcroed him in, and every time his mom put him in and tried to feed him, he would scream and turn purple. And so she would take him out, put him back in his bed. She was trying to figure out, so she would put him in his old chair, which was falling apart. She finally Googled us and found the DDSD clinical services number, and they put her in touch with Betsy Finley, the bureau chief at the time. She's a nurse. She's since retired, but she called the SAFE Clinic and said, we need to do an emergency evaluation because he had lost 20% of his body weight in 6 months. And he was a tall guy, and I think he was down to 89 pounds and was not doing well. And so we did see him. We started fitting him for a wheelchair. We got SLP emergency services on. We got a PT to evaluate his wheelchair. Everything was ordered. He aspirated, ended up in the ICU. Oh. He was in the ICU for 7 or 8 weeks, ended up with a trach, a G-tube, a suprapubic catheter, and was sent home in completely different condition than he had, because he had been relatively healthy until he got that wheelchair. And so it just goes to show that multidisciplinary is so important in this world that you can't, the physician can't figure out how the wheelchair is supposed to fit unless they're specifically trained. And so you do need that team. You need your nurse and your dietitian and your physical therapist and your neurologist and orthopedic surgeon. Everybody has to work together.
I couldn't agree with you more on that point. And, we talk about collaborative medicine and interdisciplinary medicine and integrative care. And I think in people with IDD, that's even more important. It's important for all of us. I always talk about, our minds are connected to our bodies and our bodies are connected to our minds. And we need to have that combination of mental health and physical health and oral health as well. But when you're, working with people with multiple different types of problems, you need different types of specialists that have different types of expertise, and to have them work together to solve, complex problems and improve a situation for a person. I think it's even more important. And to me, that's kind of one of the interesting things and really joys about working in this field, as you get to do that, and you make improvements in people's lives and in ways that are very, very meaningful. And, it's one of the reasons we do this podcast, is to help people to recognize this as a field of medicine or support or a field that you can work in and really have a very positive impact on the lives of other people.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So one of the things that I do on the show is something I call 3 in 3. It's 3 things in 3 minutes. And I'm not going to hold you to 3 minutes. But, little tips, little words of wisdom, little pieces of advice that you would recommend or you want people out there to know that you think can improve health and wellness or the world of supports and services for people with intellectual and developmental disabilities?
Well, I'll say from the healthcare standpoint that the reason our program's been around for 30 years and we've had almost the same team for the entire time is that we kept it consultative. We do not take over the primary care of the people. We consult, we teach, we build capacity, we help the teams by giving some suggestions and kind of guiding decision making, teaching them how to, whether it's the primary medical and psychiatric team or whether it's the DD waiver team, we don't take over. And I think that has kept people from burning out, and B, it builds capacity. So as we have grown and people have gotten more and more complex problems, TES doesn't see people until it's like really hard, like very desperate, because the primary care and the psychiatrists, they know this stuff now. They don't feel like they don't have an expertise because they've worked with us and they've gotten this teaching and training. And so I have the teams.
Yeah, that's a real testament to the effectiveness of the program. And I love the capacity building aspect of it.
Yeah.
Yeah.
And I would say let me think about the next thing is to take time and listen, especially listen when somebody can't communicate. And that means you listen with everything. You're not going to hear words, but you're going to see very subtle change in the way that they look as you're palpating the abdomen or as you're putting them in their chair. You may see just even a widening of the eyes, a change in color, a change in the heart rate. You have to listen differently. As a primary care provider, I have been taught by people who taught me how to listen differently. Taught me how to do a physical exam differently. How to take a history and physical differently. Not better, it's just different.
I love the way you presented that. And I talk about we have to listen with our ears, but we have to listen with our eyes and be very observant in this field. And it is for those little subtle changes. And sometimes, a person's might be referred to me to evaluate them because they're just not acting right. Mm-hmm. And what I would do, the first thing I would do sometimes, I would just sit there and just watch them.
Yeah. Mm-hmm.
Watch them for a while, do nothing else. And it's amazing what you can learn when you just are quiet and observant, and you can pick up on so many little subtle changes. I love that. Yeah.
And then I guess the other thing is that I've learned to listen to families and teams. So that would be my 3, I guess, is that we have the luxury of time, but we also have the luxury of getting everybody in the room at the same time and listening. So we hear what the direct care staff and cousin who does hands-on home health aid work for the MCO part of it. We hear what the nurse has to say. We hear what the physical therapist, occupational, the CODA, the PT aide. We hear what the case manager has to say. We hear what the physician has to say. And most importantly, we get to hear what the family and the individual have to say. And we have already got the history by doing the chart review first, so we can listen to their words without having to dig through the chart or ask the full medical history. So we go in with kind of armed with all the baseline knowledge that we've read already, so we can kind of go through our review of systems and our interview without having to start from square one. And so we get a good solid couple of hours face to face with that whole team, and we listen. I feel like we do a good job of that.
I know you do a good job. I saw it firsthand. Yeah. Those are 3 great pieces of advice for anyone who would work in this field, especially in a healthcare setting, on ways to do things and ways to approach things. Toni, if people want to find out more about TES, how do they do it?
Probably the easiest way is to go on the University of New Mexico Health Science Center website under Family and Community Medicine, and we are listed under one of the clinical programs there.
TEASC is the acronym, right? Yeah. Well,
there's a few broken links, so if you just Google TES, put in UNM TES, you'll usually get there. But if it doesn't seem to be working, then go to the Family and Community Medicine homepage and then look for our name under the clinical programs.
Well, Toni, you've been an inspiration to me for a long time. I love the work that you do. I was very fortunate to be able to spend a few days with you and watch the team in action. And I just want to thank you not only for taking the time to be on the show today, but for the incredible work that you do in this field.
Well,
Thanks, Toni.